Hi, everybody. So, I thought that in my absence this week, since some of you won't get to see some of the bones being presented, that I would take some time to film some videos to get you familiar with some of the bones of the body. This particular sequence will focus on the bones of the lower limbs, so the three bones that make up the leg. We're going to exclude the feet here. We'll deal with that later. But for now, we will cover the femur, which you see here. We will also cover the tibia, which is the more medial and the more anterior of the two lower leg bones. And then the fibula, which is this long, thin bone right here, which is slightly lateral and posterior to the tibia. So we'll start with the femur. The femur is the largest of the long bones in the body. We see that it's pretty substantial here, therefore it's rather difficult to fracture. And so this is what we see from the anterior side of the femur. It's difficult to get it on the frame because it is quite long. But at the proximal end, sorry, I lost the word for a minute, that forms the hip joint up here, the part that joins with the acetabulum of the coxa, the hip bone, to form the hip joint is the head. When someone gets a hip replacement, quite often the head of the femur has degraded a bit, and so they have to basically chop off the head of the femur and replace it with a titanium ball that then fits very well in the socket of the acetabulum. So we have the head here, this rounded projection here. Right below it, as you might expect, this is the neck. And then if we look from the posterior side, it's a little easier to see from here, we would see the greater trochanter, this projection on the lateral side of the bone, and the lesser trochanter, which is a bit more medial and very much on the posterior side of the bone. These are obviously both very important sites for muscle attachment in the femur. And then, as we continue on the posterior side, we'll actually be able to see everything from here. We see a line that goes all the way down the posterior surface of the femur. And this line is called the linea aspera. And as we go further and further down toward the distal end of the bone, the glare is really playing tricks with me here, but I think we can make this work. So we have two condyles right here. For our purposes, the condyles are going to be projecting posteriorly toward the back of the body. They also wrap around sort of underneath here, but we'll identify them from the back. If we kind of go up here, we notice that the head is over here to the right of your screen, and so anything on that side will be medial. So we notice that the medial condyle here goes a little bit out from the center of the bone, a bit more so than the lateral condyle. So the medial condyle is here, it projects out a little bit, and the lateral condyle is right here. Now, on the margins of the bone, right on the outside here, we have the epicondyle. So you notice that I always have to check. I'm going to try to give you some frame of reference on an assessment to let you know which is which, but this up here is the greater trochanter, so this would be the lateral side of the bone, which would make this the lateral epicondyle right here. This is actually the site of attachment for the lateral collateral ligament, or LCL, and here on the medial epicondyle is the site of attachment for the MCL, or medial collateral ligament. These are both ligaments that help to prevent excess side-to-side motion, excess lateral motion in the knee. Very important for stabilizing the knee joint. And really, that's about it for the femur. So let's move on to the tibia here. The tibia, along with the patella and the femur, form the knee joint. The fibula really isn't a functional part of the knee joint, as it's further back and more lateral, and so it doesn't actually form any attachments within the knee joint. But the condyles of the tibia join up with the condyles of the femur to form the knee joint. There's cartilage in between. So we have here on the distal end, this is really the most important landmark here, and the landmark that's going to show you exactly what you need where things are. This is called the medial malleolus, and actually, if you feel on the inside of your ankle, you'll feel the medial malleolus right there. It's actually a bump on the inside of your ankle joint. So you can actually find this landmark pretty easily, and so could a doctor if you suffered an injury to that area. So as we trace up here, we notice that the condyles are actually on the superior surface of the tibia here. And so this side that is on the same side as the medial malleolus must be the medial condyle. And then this side on the opposite side would be the lateral condyle. So again, the condyles of the tibia join up with the condyles of the femur to form the knee joint. And the only other landmark that you need to know here on the tibia is this bump right here. This is a little more toward the lateral side. You see the lateral condyle right up here, and that is the tibial tuberosity. The tibial tuberosity is a really important attachment point for the patellar tendon, which holds the patella in place and again helps to stabilize the knee joint. So that's the tibia. That's about it. And then the fibula is even easier. The fibula, as you can see, is a very long, very thin bone, and really all you need to know are the two structures at either end. This actually is the proximal end that you see near the knee joint. You can see that it's sort of diamond-shaped. There's nothing in particular sticking out of that area, and this area at the proximal end is known as the head. So as we go further and further down to the distal end, we can see here that there's a part that sticks down out of this bone, and you can see it a little better from here, almost like a thumb, sort of sticking down off of the bone. And this is on the lateral side of the fibula. This is actually called the lateral malleolus. And that's a bump that you can feel on the outside of your ankle joints. So the medial malleolus of the tibia on the inside and the lateral malleolus of the fibula on the outside are very important landmarks to kind of mark where the ankle joint is located. So that is the lower limb, rather, and I hope that's helpful. Thanks.